I'm not a doctor, I'm a clinical psychologist, and I work with families. I'm also a mother. My daughter, my eldest daughter, has autism, so I'm being very involved in more in the therapy and how to approach that. I thank you, Dr. Munir and Dr. Özgür, because they really introduced my presentation, telling us how difficult the problem we have here. We have a very, very complex situation. We have a very complex problem in autism, and at the same time, we have therapists who are lacking the evidence, who are also, even if they have many studies, these studies are false, they have so many problems, and we as clinicians have a lot of problems what to tell parents, what are the best treatment they can do. And also, in Turkey, because I work in Turkey, many of the studies and the treatments that it will introduce you are not available. So it's really, for Turkey, it's a very complicated situation. So these are my sources. I really looked, of course, it's coming from the States and from England, from the UK, the ones that they are reviewing, they are doing this meta-analysis or reviewing all the studies. So first, I want to tell you there are two types of revisions. One that look at the comprehensive ones, and then there are practices that include many treatments. There is not only one approach, but they are comprehensive, and usually they are very intensive, and they take minimum 25 hours a week for a kid, up to 40 hours. They are very extended in time, so we are talking maybe about 1 year minimum. And then there are more focused interventions. These ones, they are specific, and they usually last less, so they are very short in time. In the comprehensive one, we have three types of treatments, three types of intervention. Applied behavior analysis. Within this one, we have clinic or home-based, so they do the intervention at the clinics or at the home, at classrooms, in the schools, or inclusive, all of them. We have also developmental and relationship-based interventions, and idiosyncratic, whatever is going there. So this is of the comprehensive treatment. There is a review of all the ones existing now, all the comprehensive treatments, all the comprehensive interventions. This is in the States, so that you can look at all the ones. They are here. This is the second one. So they are within the three categories. They are within the behavioral, the relationship, idiosyncratic. They are all the different ones that they are going now. And if we look at them, here I put I graded myself. All of them, they look very good at the operationalization. They are really good at that, but the outcome data is not that good. And also we can see that only out of all these ones, only 5 of them, there can be, as Özgür Hoya said, they can have some kind of moderate. They have some kind of, their outcomes are really some kind of good. Then we have some others, and they are really having very, very low punctuation, and all of them, they are very costly. So I want you to think about the cost, not only for the families, but also economical cost of all these interventions. So for the focused intervention practices, there are mainly two national projects. One of them is the NPDC, and the objective is to identify focused intervention practices that have evidence of effectiveness in promoting positive outcomes for learners with autism spectrum disorder. So 456 studies were accepted, out of what only 27 meet criteria. As Özgür was saying, they look really at all, if they were biased and all the things that he explained. So out of 456, only 27, and mainly they were in the area of behavior analysis, assessment, like functional analysis or analytical skills, parent implemented interventions, technology aided, and combination of behavioral practices uses in a routine and systematic way. This is like teach, like they use this intervention, but they are doing more in a routine way. So out of all these, as I mentioned before, the 456, only 27, and here you can see all of them. Just keep in mind the green one, I'll explain you later why I put this in green. So we have all these 27. We have cognitive, we have mainly behavioral, discrete. So all those are techniques, all those are intervention, they focus in one thing and will help to develop, will help will help the kids to do good in one thing. There is, see, keep in mind the green ones, please. So they are prompting, they are scripting, all of them are techniques. The other study that look at this is the National Standard Project, NCP, and the NICE. The NICE is from England, and the other one again from the States. This one in the National Study Project, they have two phases. In the first one, they look at 775 studies, and at the second one, 389. The difference is in the first one, the studies were including only children or people under 22, and in the second phase, they also including 22 people with more than 22. And this evidence, as mentioned before, is well established. The treatment had established. It was emerging and established on ineffective or harmful. Again, the findings for the first one, only 11 were established interventions, 22 emerging, and 5 they say that they didn't have any validity, and 0, no one were harmful. In the second one, again 14 were really established, so they have research and the people, they have enough evidence. 18 again emerging, 13 that they didn't have any proof, there was no sound of evidence, no effectiveness. And for the second one, this is for children under 22 or adolescent. For the adults, more than 20-year-old, there were very, very few studies there, and therefore, so the results are really, really low. 1 only for established intervention, 1 for emerging, and 1 that they didn't have any results. So there is still really a need for more intervention for elder people. So again, which ones are these established interventions? What are the availability of these techniques, let's say, because they are not complex, that specific techniques that we can use as clinicians for our children under 20 years old? Again, behavioral interventions, cognitive behavioral, comprehensive behavioral treatment for children. Here, everything is included. It's not only the focus one, but also the big treatments, the comprehensive treatments. Language training, modeling, natural setting strategies, parent training, peer training packages, pivotal response PRT, pivotal response training, schedule, scripting, self-management, social skills package, and study-based interventions. I wanted to mention the emerging one because the gap between one study and the people, and really the time to get to the clinicians is really very long. So there is, and for Turkey, especially for Turkey, when we get this treatment, when we get the information, we get the education about this treatment, already so many others have come, and there are already so many things that are happening, and they are looking at this, and we need also to look at those. So there are many emerging treatment, and I think they will have a big future, and then we really need to look at them. So there are development, relationship, treatment, exercise, a special package, functional communication training, imitation-based interventions, initiation, language training, massage therapy. These ones some of them, they have good results, some of not, but they need more to be looking more at it. Music therapy, PECS, reductive package, science, social communication intervention, structured teaching. So this is for NCP. For the NICE review, they and Osgur mentioned the ones for the one in the behavioral challenges. They do something different. They look intervention in for four aims. So they look at interventions that aim at the core features of autism. They look interventions that they treat behavioral, challenging behavior. They look at interventions that are associated features of autism, coexisting comorbid conditions, and at the families, and how these, there are some treatment, how they improve the impact on the families. Here you can look, I choose one of the studies, then they look at the core feature of autism, because this is what I'm working with. I usually work in the social communication area. I work with very small children. So here I looked, this is all the studies in England, in the UK, then they work on the effects of social communication interventions. So there you can look the main studies that are happening, and again, how low, very low, very low, very low. We see two moderate, so we are lucky. There is no one that really there is high evidence. I have seen, there are like two big books like this. I look at them, I couldn't really find one that really have high evidence. I think I was lucky if I found, I didn't count how many with moderate. So here, in the moderate, the moderate is only in one aspect, actually in two. They are moderate not in all what they're aiming for, but they are moderate, they have moderate results in parent-child joint shared attention and examiner-child joint shared attention. So all the other things that are working on, they don't have good results, only in these two areas. One of them is the one I work with, is packed intervention that I do with parents. So I was lucky, I choose this one also because of this, because they have good moderate outcomes for the parent-child shared attention, joint attention. So even they didn't find the NICE, didn't get after all this review, they didn't see that the studies prove much, those are their recommendations for the core feature of autism. So consider a specific social communication intervention that includes play-based strategies with parents and teachers to increase joint attention, engagement, and reciprocal communication in the child or the young person. So these strategies should be adjusted. This is something that also Dr. Muniz said. No one child is the same. I know one child with autism, my daughter. I'm trying to meet, I meet many of them, but I don't really know them. They're all different. So we really need to, all these treatments really need to be adjusted to that particular person, what is really complicated. And they have to aim to increase parents, career, teachers, or peers, people. It's not only, we are changing and we are not focusing so much on the child, but the people around the child. So what we are trying is help people around to help the child. So that's why parents or teachers, peers need to be included in these interventions. Techniques like modeling, video, really have good results. Also, any techniques like interactive play, social routines, that will expand the child communication. So this is because we are looking at the core feature of autism, one of the core features of autism, this communication, we really need to do it within the situation, not outside. These ones, they should be delivered by a trained professional, and for preschool, consider parents. So again, depending also on the age, the interventions are going to change. It's not, there is no one solution for all of them. So if we have a little child, we cannot pretend then to take them to a service. We have to go to the child. We have to go to the main care, to the parents, and teach them how to do it. So in a school, there are much better results there, I didn't show them, when peer mediations is in place. So we need to get the people around the child involved in these interventions. So what are we here in Turkey? We have very few educational university programs. I think recently only one in autism. For the behavioral intervention programs, I don't think, recently one of them is going to start. There are very, very limited intervention available, and even if they are not, as far as I know, there is only one really replica, one of the comprehensive treatments, then they are really looking and they are really doing it professional. Many associations are just doing what they can do because they don't have enough, in my opinion, they don't have enough information, not education. The economical situation and the reality for the families is they don't have access and also is so expensive. So really we need to provide here in Turkey more economical, more treatments and will deal with the reality of the country. The needs exceed the resources. This is everybody knows. There are so many kids and they are not even taking them in the schools. People don't know. The parents don't know what to do with them. So they really is a huge need. There is a big need here to serve these people, to serve these children and their families. And lately we have done a lot of early diagnosis. We are doing a lot in early intervention in Turkey. So there are many children that they are being diagnosed very early. But again, we don't have the most important part. What do we do with them? So really there is a big gap between what is out there and what we have here in Turkey. So why I will introduce a little bit to PAC intervention principles. This is the intervention I do with the parents. And it targets the green things that I showed before. That's why they're reflected here. This intervention, it's nice standards. So, and also many of the other technical interventions, they're reflected here. So we use those techniques here. We use those techniques are taken in impact. So target communication and language has an orientation, developmental orientation, focus on the natural settings. And the natural setting in dyadics, that means parent and child, because it's done with parent and child or parent, child and teacher. It's within the context of communication. Parent mediated, there is a second program that is doing at the school, but it's still in research. And it's video aided. So these green ones are all the ones that NICE recommended, and the other before they were also those techniques that they were recommended. As is also individually adapted, what I think is very important. Alter language development course. We are trying to get the children to go in the communication problem they have, try to alter that, to promote more right dyadic intercommunication, so they go away from the wrong path. And the parents have the locus of control, so we teach the parents. We teach the parents how to do it. They are the ones who have, we teach them how to do it. Here I will show you this transforming skill, how is from their research, the PAC research. I will show you afterward a little slide about the research that they are doing. It's go from the research to the supervisor teaches the professional, with the professional teach the parents, so the parent is the child.
We have 2 minutes.
Okay, so all this you can see, and this also one of the 6-year follow-up trial that they did, and my references.